Africa invented modern medicine and nobody told you. The global pharmaceutical industry is worth over $1.4 trillion annually, and a significant percentage of the drugs on those shelves, the ones your doctor prescribes, the ones that have saved hundreds of millions of lives, are derived directly from plants that African healers were using centuries, and in some cases, thousands of years before a single Western laboratory ever existed. They did not get credit. They did not get compensation. And most of the world was never told. Today on the African Memory, we are going to name the plants, name the healers, name the knowledge, and name the industry that built its foundations on African botanical wisdom, and then acted as though Africa had nothing to do with it. Because this is not ancient history. This is happening right now in laboratories, in patent offices, in boardrooms today. The plant is African, the knowledge is African, the healing tradition is African. The trillion-dollar industry built on top of it did not share a single cent with the continent that made it possible. This is the African memory, and today we remember the healers the world forgot to thank. This is not just history, this is your history. Let's remember it together. The scale of what Africa gave. Let me give you the scale of this first, because without understanding how large this story is, the individual examples that follow will not land with the full weight they deserve. The World Health Organization estimates that approximately 25% of all modern pharmaceutical drugs contain active ingredients first identified in or derived from plants used in traditional medicine systems. 25% of a $1.4 trillion industry. That is $350 billion of annual pharmaceutical revenue, tracing its scientific origins to traditional plant knowledge. Now consider this. Africa contains approximately 25% of the world's total plant biodiversity. The continent has between 40,000 and 45,000 known plant species, thousands of which have been used medicinally by African healers for generations. The rainforests of Central Africa. The fynbos of South Africa, one of the most biodiverse plant ecosystems on Earth. The savanna pharmacopoeia of East Africa. The desert medicine traditions of North Africa. Africa is not just one of the world's great botanical reservoirs. It is the world's most under-acknowledged medical library. And sitting inside that library for centuries, for millennia, were men and women whose entire life's work was understanding those plants, their properties, their applications, their interactions, their dosages, their combinations. These were not guessing. These were not superstition. These were systematic, empirically developed, generationally refined bodies of medical knowledge built through centuries of careful observation, experimentation, and practice. In other words, science. African science that the world took and did not acknowledge. The plants that changed the world. Let me introduce you to some of them. Because these plants deserve to be known by name, not just as unnamed sources of pharmaceutical profit. The willow tree, found across Africa, including indigenous African willow species that African healers used for centuries to treat pain, fever, and inflammation. The bark of the willow contains salicine, which the body converts to salicylic acid, the compound that became aspirin. One of the most widely used drugs in human history. taken by hundreds of millions of people every day, generating billions of dollars in annual revenue. Its active mechanism derived from a compound that African and other indigenous healers had been applying for centuries. The Rosy periwinkle. Originally from Madagascar, the island off the southeastern coast of Africa, used in traditional Malagasy medicine for centuries to treat diabetes. When Western pharmaceutical researchers investigated this plant in the 1950s, they did not find a diabetes treatment. They found something far more valuable. They found two compounds, vincristine and vinblastine, that became the foundation of chemotherapy treatment for childhood leukemia and Hodgkin's lymphoma. Childhood leukemia, once almost universally fatal, now has a survival rate of over 90%, in large part because of treatment protocols built on compounds from a Madagascar plant that African healers had been using for generations. The pharmaceutical company Eli Lilly built a product line worth hundreds of millions of dollars from those compounds. Madagascar, one of the poorest countries on earth, received nothing. Devil's claw, a plant from the Kalahari desert of southern Africa used for centuries by the San people and Khoikhoi communities to treat pain, inflammation, digestive problems, and fever. The San people, among the oldest continuous human cultures on Earth, had developed a detailed pharmacological understanding of this plant over thousands of years. Today, devil's claw extract is one of the most widely sold herbal supplements in Europe and North America. The European herbal medicine market for devil's claw alone is worth hundreds of millions of dollars annually. The San people of the Kalahari, whose ancestors developed the knowledge that created this market, live in some of the most extreme poverty on the continent. Hoodia, another Kalahari plant, used by the San people for thousands of years as an appetite suppressant during long hunting expeditions. When food was scarce and distances were vast, San hunters chewed hoodia to suppress hunger and maintain energy. In the 1990s, the South African Council for Scientific and Industrial Research, known as the CSIR, identified the active compound in hoodia, called it P57, and licensed it to a British company called Phytopharm for approximately $21 million. Phytopharm then sublicensed it to Unilever, the multinational consumer goods giant, as the basis for a weight loss product line projected to generate billions. The San people, whose ancestors developed this knowledge over thousands of years, knew nothing about any of this. They were not consulted, they were not included, they were not compensated. Until they found out and fought back, and in 2003, after a legal battle that made international headlines, the San people reached a benefit-sharing agreement with the CSIR, the first agreement of its kind in African history, a landmark moment in the fight against what scholars now call biopiracy. What is biopiracy? Biopiracy, it is a word you need to know, and a practice you need to understand, because it is one of the most significant ongoing acts of economic extraction from Africa that almost nobody is talking about. Biopiracy is the appropriation of biological resources, plants, genetic material, traditional knowledge from indigenous and local communities without their consent, without fair compensation, and without acknowledgement of their contribution. It happens like this. A traditional community has used a plant medicinally for generations. A researcher, often from a Western institution or pharmaceutical company, learns about this use, either through published ethnobotanical research, through fieldwork, or sometimes simply through taking a plant sample and testing it in a laboratory. The researcher identifies the active compound, files a patent, The patent grants the company exclusive rights to commercialize that compound, sometimes for 20 years or more. And the traditional community that developed the knowledge that led to the discovery gets nothing. Not even acknowledgement. This is legal. Under current international patent law, you cannot patent a plant itself, but you can patent a process for extracting a compound from a plant. You can patent a specific formulation. You can patent an application. And the traditional knowledge that pointed you toward that plant in the first place, that knowledge has no legal protection under the framework that currently governs global intellectual property. Think about what that means. A son elder who spent 70 years learning the medicinal properties of Kalahari plants, inheriting knowledge that was itself the product of thousands of years of accumulated wisdom, has less legal protection for that knowledge than a pharmaceutical company that spent 6 months testing a compound in a laboratory. That is not a market failure. That is a system designed to extract value from the global south and concentrate it in the global north. A system with deep roots in the same colonial logic we have encountered in every video on the African memory. The ancient African medical tradition. Now let me take you back. Because the story of African botanical medicine does not begin with colonial extraction. It begins, as so many African stories do, in deep antiquity. And it is extraordinary. The Edwin Smith Papyrus, dating to approximately 1600 BC, but believed to be a copy of an even older text from around 3000 BC. It is one of the oldest medical documents ever discovered. And it describes 48 medical cases, injuries, wounds, tumors, with rational, systematic, observation-based treatments. No magic, no ritual. Cause examination, diagnosis, treatment. This is evidence-based medicine in Africa 5,000 years ago. The Ebers Papyrus, another ancient Egyptian medical text from around 1550 BC, contains over 700 remedies and prescriptions. It describes treatments for asthma, heart disease, diabetes, depression, and contraception. It includes surgical procedures, wound care protocols, and a sophisticated understanding of the cardiovascular system, including the recognition that the heart was the center of the blood supply. In 1550 BC, in Africa. But ancient Egypt was not the only repository of African medical knowledge. Across the continent, in every region, every ecosystem, every cultural tradition, African communities developed detailed, sophisticated, empirically grounded medical knowledge systems. The Yoruba traditional medicine system, Ifa-based, classifies diseases, identifies plant treatments, and describes surgical interventions with a level of systematic organization that ethnobotanists are still fully documenting today. The traditional medicine of the Zulu and Xhosa, the Isangoma and Inyanga traditions distinguishes between physical and psychological illness, uses plant-based treatments for both, and has produced compounds that modern pharmacology is actively investigating. The healers of the Congo Basin rainforest, one of the most biodiverse ecosystems on Earth, have catalogued the medicinal properties of hundreds of plant species that Western science has barely begun to study. These are not folk remedies. This is not superstition dressed up as medicine. This is centuries, millennia of systematic empirical knowledge about the relationship between plants and the human body. Knowledge so sophisticated that it is, right now, actively guiding the research agendas of pharmaceutical companies around the world. The difference is those companies are not telling you that. the fight back and the future. But here is where the story of African botanical science in 2025 takes a turn that I want you to pay attention to. Because this is not only a story of extraction and injustice, it is also increasingly the story of reclamation. The Nagoya Protocol, adopted in 2010 under the Convention on Biological Diversity, it is an international agreement that requires companies and researchers who use genetic resources and traditional knowledge from a country to share the benefits of that use fairly and equitably with the country and communities of origin. It is not perfect. Enforcement is inconsistent. Many companies find ways around it, but it represents a fundamental shift in the international legal framework, an acknowledgement that traditional knowledge has value and that its holders have rights. African countries are increasingly asserting those rights. South Africa has developed one of the most progressive indigenous knowledge protection frameworks on the continent. Kenya, Nigeria, Ethiopia, and others are developing national policies to protect and commercialize their botanical heritage on their own terms. African scientists are reclaiming this space. The African continent today has a growing community of ethnobotanists, pharmacologists, and traditional medicine researchers who are documenting, protecting, and developing African botanical knowledge, not for export to foreign companies, but for African healthcare systems, African patients, and African economic development. And traditional African healers, long dismissed by colonial medicine as primitive, are increasingly being recognized as the knowledge holders they always were. Partnerships between traditional healers and modern researchers. Databases of traditional knowledge that establish prior art and prevent biopiracy. Community protocols that give local communities legal standing to control how their knowledge is used. Africa is not waiting for the world to acknowledge what it contributed to global medicine. Africa is building the systems to ensure it never gets taken again without permission, without partnership, without compensation. That is not just justice, that is the future of medicine. I want to end this section with a question, a genuine question that I want you to sit with and that I want you to take into the comments below. When a San elder's lifetime of botanical knowledge leads directly to a pharmaceutical compound that generates hundreds of millions of dollars, what is the fair response? Is it a one-time benefit-sharing payment, even a generous one? Is it ongoing royalties? Is it the right to co-own the patent? Is it the transfer of pharmaceutical manufacturing capacity to African countries so they can produce and sell these medicines themselves? Is it all of the above? Because the Hoodia case, where the San eventually received a benefit-sharing agreement, is considered a victory, a landmark, and yet Unilever ultimately shelved the product before it reached market. The San received some compensation, but the full commercial potential of their knowledge was never realized, and they had no control over that decision. What does justice actually look like here? I genuinely want to know what you think, because this is not a settled question. It is one of the most important ethical debates in global economics right now. And African voices, your voice, need to be at the center of it. She learned from her mother, who learned from her grandmother, who learned from hers, a chain of knowledge stretching back further than any pharmaceutical patent, further than any university, further than any laboratory. She knows which leaf brings down a fever, which root eases a troubled mind, which bark fights infection, Which combination of plants addresses what the body cannot fight alone? She knows this the way she knows her own name because it is part of who she is, part of what her people are. That knowledge saved lives long before aspirin had a brand name, long before chemotherapy had a protocol, long before a single pharmaceutical company filed a single patent. The African memory exists to say, we see her. We see every healer who came before her. We see the knowledge they carried and the lives it saved and the industry it unknowingly built. And we are saying clearly on the record without apology that knowledge was African, that contribution was African, and Africa deserves not just acknowledgement, but a seat at the table where the future of global medicine is being decided. Because the plants are still here, the knowledge is still here, the healers are still here. And so are we. Subscribe to the African Memory. Share this video with someone in healthcare, in science, in medicine who needs to hear this story. Leave a comment with your answer to the question I asked. What does justice actually look like for African botanical knowledge? I will read every single one. And come back, because next time we are going into artificial intelligence. African judicial ethics and the future of responsible AI. That story next time. The African Memory. Remembering Africa. Reclaiming meaning. I'll see you in the next one.